Welcome to the Redhead Reveal podcast. I am Jenn Pinkerton, your Redhead host, a psychotherapist, writer, speaker, the private practice owner of Pinkerton Psychotherapy, and a connection expert. I help people reveal their connectedness within their relationships and sexuality, understanding root causes of beliefs and behaviors that hold them back from success, and assist them to returning to the person that they are born to be before they were limited by trauma, societal or social concerns, or attachment wounds. Redhead Reveal is here to share concerns and questions, provide interviews with thought leaders and friends, and to hold space to discuss life struggles and encourage vulnerability, authenticity, growth, and self-awareness. So excited today because I want to welcome Kathryn Smyth. Katie works here at Pinkerton Psychotherapy, and she really specializes in something that I think is so unique and such an amazing opportunity for people to really heal from trauma. We're going to talk about EMDR today. We're going to talk about trauma work today. We're going to talk about why this is really the gold standard in trauma work. And I feel like there's a lot of people who may have heard about it, who understand it, and I think they understand it, but don't really know the nuances of it or how it works. So we're going to dig in that pretty deep here and really give a great overview of how this works. But I want to start off and really kind of give you the opportunity to tell me about you, talk about your experiences and what got you to where you are today, and
Great.
give us your bio, so to speak.
Well, thank you for having me, Jen.
Sure.
I'm very excited. So I am a licensed clinical social worker. I got my start in Los Angeles, where I was living after graduating from undergrad at Pepperdine University, and got my MSW at University of Southern California. Go Trojans! And started my clinical experience in community-based mental health. So residential treatment centers, outpatient intensive services, foster care, adoption, with really high risk, high needs population, which was my intro into working with trauma. I didn't necessarily, when I was in grad school, intend to work predominantly with trauma. I really wanted to work with kids and teens. And then as soon as I got into the community-based work, realized that the vast majority of the clients that I was seeing, the underlying need or the underlying issue that was presented in their cases was a history of trauma. And so that kind of led me on this search of, okay, how can I help meet that need? What can I do to help these clients really get to the root of the issue rather than just treating like symptoms and behaviors? How can we actually help them to resolve the trauma that they've experienced? So that, of course, then eventually led me to EMDR, which is eye movement desensitization and reprocessing therapy. As you said, it's the gold standard of trauma treatment. There's a lot of studies and evidence that shows that EMDR is the most effective or one of the most effective treatments for trauma. And that goes for adults and kids and teens as well. So that's how I ended up being an EMDR practitioner. And
That's wonderful.
I love it.
And I'm so glad that we get to have you here to be able to serve so many people. I want to explain really what trauma is also for people who don't really have an understanding. And I'm going to use my own definition because everybody kind of, I think, adopts their own and what fits for them. But the way I explain it to my clients is basically a traumatic experience, and trauma is anything that overwhelms or exceeds the body's ability to cope at that moment.
Exactly.
And there's the difference between little t trauma or big T trauma. And for those of you who don't really understand that difference, little t can be something as simple as I'm on the playground and I'm 5 and I remember feeling like I didn't belong. I remember feeling as though I couldn't fit in. And I've carried that traumatic experience of someone causing me to feel that way about myself, and my worldview changed at that moment.
Exactly.
And that traumatic experience carried with me as an adult. And maybe at age 30, I'm having a hard time really feeling like I belong anywhere. And maybe in a job, I'm held back from that. So, relationally, it can be a problem. And that little t trauma is not to be minimized. It's not to be compared. It's just as impactful. And then big T trauma are things that I think we more commonly associate with trauma.
Right.
Neglect, abuse, assault, a lot of things that can be continually and complex or acute and one time still affect the body in this way that we can't get past it. And we might be highly resilient and we might be able to function, but we're held back or we're stuck in so many ways. Since I specifically work with relationships and connection, I often see that people get stuck in that way. And I want to refer them to someone like you to be able to work with them on those traumatic memories and those experiences to be able to recreate a new narrative, a new way to process that emotional content. And that's kind of the way I look at that from my lens. What do you think about that? And how do you think that relates to your viewpoint?
Oh, absolutely. I mean, so trauma is not necessarily the event itself. It doesn't really matter the magnitude, right? Big T or little T. But it is our emotional response to the trauma that creates short-term and long-term impact, right? So it's basically a nervous system overwhelm. And it really is a neurological response, and it actually is an adaptive response to certain stimuli, right? Like we want to have a nervous system response because that's what keeps us safe.
Right.
The problem lies in when the memory of the event is maladaptively encoded. That's why EMDR is so effective, which we can get into in a little bit. But essentially, what trauma does is it creates a system overwhelm in the most primitive part of our brain, which is the amygdala, right? That's our stress response. It's our fight, flight, freeze response. And so when we perceive an event to be risky or unsafe, when we feel threatened, that stress response is initiated. It creates a stream of cortisol, which is a stress hormone, a neurotransmitter, that then creates some somatic changes in our body. So our pupils dilate, we feel tension in our body, blood flow kicks in, our heart starts pounding faster because we perceive, right, a danger that we need to protect ourselves from. Now, of course, if the memory is not encoded properly or is not like transmitted properly, then because our memories are associative, when we experience something after the trauma has been completed, right, we're not in the trauma anymore. But if there's things that trigger us, that remind us of the trauma, that we associate with the trauma, that stress response is going to start again, even if we're actually in a safe scenario or a safe experience. That's why trauma is so impactful.
And I think that's so important when you mention on that, even if we're in a safe experience, because a lot of people will come, they'll come to seek therapy. They have this presenting concern of they're so triggered and they don't understand why. That they're having such an overwhelming physiological response to something that emotionally they can't make that connection. And I find that a lot of people that have suffered from something quite complex have buried it so deep that the memory isn't there.
Exactly.
And then people say, well, how can I fix what I don't remember? And I've really been asked that type of question in a variety of ways. What would be your answer to someone that would say, okay, I'm obviously having something going on, but I don't remember anything bad ever happening?
So very common with the clients that I work with of having repressed memories, whether it is because it happened in very early childhood, so it's more a somatic experience, or because our brains can only handle so much. And so there are times where traumatic memories are repressed as a survival mechanism, as a coping mechanism, right? It does happen. So I do encourage clients to first do their best to identify what may be some of those traumatic memories. Typically what we see though is memories are stored on a memory network. Like I said, memories are associative. And so typically if we can identify a memory, let's say in our recent history that was impactful, there's usually things that are tied back further in our history to that more recent experience. So I also use a couple of skills that are about scanning your body, scanning your emotional experiences to help the client ground themselves. into a safe space so that they're then more open to experiencing or to remembering some of those traumatic experiences.
And you touch on somatic a few times. And for people that don't understand what somatic means, can you give an explanation in what you're referring to? Because I feel like there might be some listeners that don't really have an understanding of that somatic aspect.
Absolutely. So somatic is the physical body experience. We know, right, that our minds and our bodies are intrinsically tied together, and that trauma is actually stored in the body. People may be familiar with the book The Body Keeps the Score by Bessel van der Kolk. Fantastic read if anyone hasn't read it. But we know that trauma is stored in the body. I have lots of clients that come to me with physical health complaints, gastrointestinal issues, chronic headaches, chronic tension in the body, back pain, so on and so forth, that they've seen several medical providers and no one is able to give them a diagnosis or a reason for the issue that they're experiencing, right? So it's more of like they're putting a Band-Aid on the issue. They might be able to take medication or seek out other treatment. But ultimately, if that physical complaint is because of a manifestation of emotional trauma, the physical issue is not going to go away until we treat. So the somatic issue is not going to go away until we treat the trauma itself.
I agree completely. You also mentioned the protective nature of our bodies, basically, and our minds, and how we will protect ourselves, maybe, and repress a memory. That's an actual conscious thing that's happening. Maybe it's subconscious to us at the moment, but our body's making an active decision to repress something to protect us. And that gets into parts and protective parts that do that. And I'm a really big proponent of parts work and IFS. IFS, internal family systems, another modality that a lot of therapists and clinicians utilize to work with clients. And I think that parts is so interconnected with EMDR in that way.
It is.
And I think that it's important to understand that even if you don't remember that happening, it doesn't mean it didn't. And we maybe don't give a lot of credit to how powerful our mind and our body is. And we can truly believe, I have had nothing that experience that's traumatic. There's been nothing wrong. I've lived a beautiful white picket fence, life, and people think that they haven't been affected in some way. But if you're experiencing this moment in your life where you feel stuck, or you feel triggered and you just really can't put your finger on it, I feel like that is an ideal time to really do some of this investigative work and maybe experience some EMDR sessions to try to do a little bit of a research on what am I really feeling? What did I really experience and what did I not remember?
Right. And EMDR is not just for people who've experienced big T trauma. As you're mentioning, it's for someone that just feels stuck, because a big part of EMDR is actually identifying blocking beliefs that maybe are keeping us stuck, keeping us from moving forward, keeping us from functioning at the level that we want to function, engaging in healthy relationships, whatever a person's definition of success and health and wholeness looks like. There may be little T traumas that we experienced, possibly even in early childhood, that are holding us back from our full potential.
And I think the blocking beliefs is so important because a lot of people experience these cognitive distortions, which are basically just false belief systems. You know, when you have this over magnification of life, the way you look at things, you have this black or white thinking. Your immediate go-tos are not really grounded in reality. And those are things that EMDR can really help with shifting our perspective, basically our worldview that's been tainted by experiences maybe we don't remember, or been tainted simply by the little T trauma that we maybe dismiss as not being very profound.
Yes.
But yet it shows up, and it might hold us back from how we're going to relate in a relationship or how we're going to relate professionally. And I think that's so important to mention because EMDR, yes, why people will Google search it simply because, I've experienced something amazingly traumatic and I know I need some help. I think people also miss that it can help on just a daily, day-to-day type of life and the way you look at yourself and the way you look at the world.
Absolutely. I've seen profound outcomes for clients who come in wanting to work on self-esteem or confidence issues that really at the root of it were some blocking beliefs that existed because of quote unquote little t trauma that they maybe dismissed as, oh, well, I wasn't abused as a child, or I wasn't neglected, right? I lived without want as a child, but there was maybe some small experiences like the one you described of a child on the playground, right? That is creating a blocking belief for someone.
Absolutely. What do you think about people, though, that think, oh, it sounds like hypnotherapy. It sounds like you're going to hypnotize me, and I'm afraid of that. What do you say to clients when they express that type of concern or reticence in pursuing it?
So that is one of the first things that I usually address with clients who are a little bit hesitant about EMDR, is that it is not hypnosis. I'm not a hypnotherapist. That is not my background. The most important thing is to know that EMDR, the client is fully in control. The reason why I like that and why my clients appreciate that is because trauma innately is a loss of control, right?
Yes.
We feel completely out of control, like life is happening to us. We're not participating in it. EMDR is the opposite. EMDR doesn't happen to a client. They actively participate in it. They are in the driver's seat. At no point are they hypnotized or are they out of control. EMDR is also very structured and scripted. And my clients really appreciate that because it gives them an idea of what to anticipate next. Again, because trauma removes a client's sense of agency, a sense of autonomy in the traumatic experience.
Yes.
EMDR then gives them that back. They have a sense of agency where they know exactly what's coming next. They can anticipate the next thing even the therapist is going to say, and then they get to choose where they get to go with treatment. So it's incredibly empowering.
Yeah,
yes,
exactly.
It's very empowering.
That's right. And I think that so oftentimes the idea of seeking help and seeking therapy is scary enough in itself, much less to mention doing something like this, and being able to recognize, okay, I'm going to be in control of this. I'm going to be walking down a path that I'm able to see, the path that we're going down, I think gives a comfort level to a lot of people. The other part of it, I think, that is necessary to create that comfort level is to maybe an understanding about why it even works. Can you dive in to basically, how we're accessing, these hemispheres of the brain and why it becomes, this ability to tap into these repressed ideas or to tap into belief systems and to rewrite a new narrative. Explain kind of how that works with the brain, please.
So EMDR is fascinating. Let me tell you a little bit of background about how EMDR came to be. I find it really interesting. So Francine Shapiro is the founder of EMDR. It was created in the 80s. She was finishing her dissertation for clinical psychology. As you can imagine, feeling very overwhelmed and stressed with finishing her dissertation. And she left the library one day. Someone in that
spot right now, I completely understand what that's like.
Yes. So she was seeking some peace, a moment of stillness. Left the library, went to a nearby park, and was sitting in the park and kind of zoned out and started watching these birds fly back and forth in somewhat of a rhythmic pattern. So her eyes were naturally just moving back and forth with the rhythm of the birds. And she noticed after a few minutes of doing that she felt this physical sense of calm. And of course, as a clinical psychologist, she wondered what was that about? Like, why did something so simple create such a sense of stillness and peace for her? So she investigated further. Essentially what EMDR taps into is REM sleep. It's the cycle of sleep, rapid eye movement that happens when we are at our most restful, deepest part of sleep every night. Ideally, everyone should get into REM. Some don't.
Right.
But REM is when our eyes are rhythmically moving back and forth, and that's essentially to stimulate the right brain and the left brain in a rhythmic pattern. And that is how memories from that day are adaptively encoded into those kind of memory banks or memory networks. So essentially what was happening to Francine Shapiro is when she was sitting on that bench, she was engaging in that eye movement, or what we call in EMDR speak, bilateral stimulation, of stimulating the right brain and the left brain to essentially create this sense of calm within her nervous system that naturally is just a function of our brains and of our bodies. That's the most amazing part of EMDR, is that the client actually has everything that they need within themselves to heal. We're just tapping into that natural process.
Absolutely. And there's nothing artificial about it. And I feel like when people get an idea of what that really is about, it provides another sense of acceptance of, okay, wait a minute, this isn't some, a kind of hokey idea.
Right.
Because I've shared with clients, I think this might be effective for you, and they're scared of it because it seems kind of out there.
It does.
But when you really think about how natural it is, how we're basically just working with our own bodies and our own brains.
Exactly.
And you're functioning as a guide, per se, in doing so, I think it really changes the way we view it.
Exactly, yes. And I always remind clients of that, is that they can trust themselves, they can trust their brains and their bodies to do what it's designed to do, to heal. Our brains naturally trend towards healing. And I just get to be a guide for that, right? My EMDR trainer actually said, like, we're just holding the flashlight, and they're the ones really bravely marching forward, using their body's natural ability to heal. So there's nothing necessarily, right, like magical or special about the therapist other than just being trained. It's really just us guiding the client in what they naturally intuitively know how to do.
That's a beautiful analogy. I really like that. And I think that also provides a sense of comfort when you look at it that way. Something else that I think is so amazing about EMDR, and I can say this from my own personal experience. I did training in EMDR. I am not a specialist nor specialize in it like you do. And I would refer my own clients to you to do that. But the reason I want to bring that up is what I personally experienced is to get that training and to be EMDR trained. You as a clinician have to actually experience EMDR. It's part of the training to do that to another clinician and then have that done to yourself. And that experience for me was eye-opening. And what I like about that so much is that when a client comes to work with you, not only do they have the ability to trust in their body, trust in their mind, experience this in that way, they also know that you know exactly what it feels like.
Yes.
And I think that provides a sense of comfort because you can really relate. And so oftentimes, when someone is facing something quite scary, because the fear of the unknown is pretty profound,
right.
I think that comfort for you to be able to say, hey, we've got this.
Exactly.
I think makes a really big difference.
Yeah.
And if I do nothing else in this podcast other than provide a sense of, psychoeducation on it, but also a comfort level with it, I think we've been really successful today with that.
Right. And I always remind clients of that. As you know, as therapists, there's a certain level, of course, of ambiguity about our own personal lives and personal experiences.
Sure.
Like, there's not a lot of self-disclosure as
right.
therapists. But one thing that I do share with clients is my own experience with EMDR and being so impactful. I don't necessarily share with them about why I was seeking out EMDR or what specifically I was healing from. But I tell clients, like, I'm not going to recommend anything, any modality, any coping skill that I haven't first myself tried.
Absolutely.
And I've seen the benefits of EMDR and have been able to actually tap into some of my potentials because of EMDR sitting in the client's seat of EMDR.
Right. And, I really believe that as therapists, as clinicians, I don't adopt this idea of we're the expert in the room. I have a much more collaborative approach in the way I work with clients, because I think that when we're in the trenches with our clients, we provide a feeling of safety, and we also empower them and lift them up to be able to overcome the things that they're seeking help for.
Right.
And so EMDR has that same component to me. It's very much a yes. While you are the guide, you're holding the flashlight, and while you're able to really create this start to finish, it's really up to the client about where they go in between.
It is.
And I like that.
The client really does have a lot of, like I said, agency and control over things. So they choose which specific memories that we're working on every session when they come in. They choose how they want to proceed with processing that memory. They choose if they feel a sense of overwhelm by when processing, if they need to have a moment of grounding, if we need to practice some of those skills like safe, calm place or container or things like that create a sense of stillness for them. If they do feel like processing the memory maybe becomes too overwhelming. So they have a sense of control.
And I think also it's important to recognize that EMDR is not requiring them to relive trauma. And I think that's a misconception that's out there, that if you experience something that was incredibly overwhelming for you, you're not coming here and we're going to force you to relive that again. That's not what it's about. But I think that's a big misnomer. You know?
It is. And I have a lot of clients that's their main concern or hesitation of EMDR is, well, I don't want to have to relive this trauma. Of course not. No one would want to have to relive one of their worst days, right? EMDR does not force you to relive the trauma. The way that bilateral stimulation works on the brain is that it does activate a certain response to the memory that is using our parasympathetic nervous system, which is essentially like our regulatory system. So while we're tapping into the memory, we're also regulating. So in comparison to like prolonged exposure or exposure therapy, which sometimes can require upwards of 40, 50, 60 hours of exposure to achieve a sense of regulation with the memory. EMDR, you're looking at possibly 3 to 4 hours or 3 to 4 sessions achieving what you can in 50, 60, 70 hours of prolonged exposure therapy. So you're not having to relive the traumatic memory.
And I think that matters so much to people. Being from a relational standpoint with my clients I work with, I often see people that get stuck from an intimate standpoint. They don't have a sex life that thrives. And a lot of people will say, I've experienced no trauma. There's nothing that happened in that. But to me, the vulnerability of intimacy becomes one of the really big stumbling blocks. And I've found a lot of my clients have used EMDR to really help their relationship in that way. And while I think sometimes people think those are two very different things, they're really not so far apart at all. What do you think about that?
Absolutely. I have a lot of clients that are referred to me because of issues with intimacy in their relationships. And then another type of client that I get a lot too is birth trauma, right? Being another very vulnerable, intimate experience that people don't necessarily think that they have trauma, but then they're faced with moments where it requires them to be vulnerable, like birth and sex in romantic relationships, and suddenly they're faced with a wall. Like there's an obstacle there. There's a blocking belief there that they're not quite sure why it exists. EMDR helps them get to the root of that so that they can fully experience vulnerability and experience intimacy in the way where they're fully present. Instead of having one foot in the past, they have 2 feet in the present.
Exactly. Another aspect I want to mention is the commitment in doing so, because I think some people think, oh, it's a one and done, it's a one session. And I know from my own personal experience, while there's so much value in having a session of EMDR, it's the series of them that can really, really make this unbelievable difference in your life. Can you talk about that and about that commitment to seeing that through and what that looks like, for clients?
So EMDR is very individualized. It's very client-centered. And so it's hard to say exactly, if a client comes to me for a session, they're like, well, how many sessions will I have to come to before I'm healed? It's really difficult for me to determine exactly how many sessions for a number of reasons. Number one is because everyone's speed or pace of processing is different. There may be someone that processes one particular memory in one session, and we call that completing a target. There may be someone who needs a little bit more, maybe it's a more challenging target memory. And so we need a couple of sessions to process that particular memory. So if a person comes into sessions or wanting EMDR sessions with, say, 5 to 10 memories, right? So that could look like 5 to 10 sessions, or it could look like longer if they need a little bit more time to process each memory. But yes, like you said, one session of EMDR would, of course, be effective. But where I see the most healing for people is when they make a commitment to EMDR, whether that's, 4 to 5 to 6 sessions, or maybe it's longer because they do have a more extensive trauma history. And ultimately, it's most effective if someone is coming in on a weekly basis, because what happens neurologically for a client is after a session, they're actually continuing to process that memory and consolidating the processing that happened during session throughout the week, just subconsciously, and especially during REM sleep. So when they come back the next week, there's actually progress that has happened in between those two sessions that they might not be consciously aware of. But once we actually tap into that memory, they're experiencing some resolution that maybe wasn't even there at the end of the last session. So routine, recurrent sessions of EMDR is most effective.
And it's just back to the amazing idea of the neuroscience and how our brains work.
Yes.
That if we start to guide ourselves into this healing space, then our brain actually helps us along the path.
Yes, it does. It's amazing.
It works together. Something else I want to mention too is that people can be seeing their therapist for their own issues, doing what we may call traditional talk therapy, but want to use EMDR as an adjunct. It doesn't mean that if you're working with a therapist you love, that you can't also come see Katie to have some EMDR sessions. They can go hand in hand, and clinicians and practitioners work very well together in being able to really effectively address concerns. Do you often see that you're working with clients that also have another primary therapist they're working with?
I do, and it's perfectly fine for a client to continue seeing their normal therapist and seek out EMDR treatment. What's most important is just to make sure that there's not overlap. So I wouldn't want a client to be processing the same trauma that we're working on in EMDR using talk therapy. So we want to make sure that there's maybe goals that are adjacent but are not exactly the same that they're working on with their talk therapist.
100%. I just see the value of being able to say, okay, we're working on these things, but maybe I can recognize this is really a troublesome concern here. And if you will go and work with EMDR, and work with Katie on this, then we'll pause that on our end and we'll be addressing something else. But when you're doing that, then you can come back to therapy and that's no longer a stopgap for us. It's no longer, this roadblock for us to work on the other things, especially when I look at relationships, when I'm working with people in a relational dynamic. Maybe in conflict, there's these traumatic memories that I see can be a problem. So we stop addressing conflict, and you're going to address those traumatic memories with them, and I'm instead working on, communication, or instead we're working on establishing a different way to look at their relationship and their goals together, whether it's another pillar of what I call these pillars that you need in your relationship to thrive. So I like the idea that it all can work in conjunction together, because I had this viewpoint that I talk about a lot on the podcast, which is feel to heal. I think that we shy away as adults, to feel our feelings. It's scary. It's vulnerability. It's unknown. It doesn't feel very safe sometimes. And I like the idea that whatever you're doing, as long as you're actually, creating this space to honor what you're feeling for it, then we're doing some good. We're getting somewhere. And I think EMDR perfectly does that. And it's one of the best examples that I could give that is another modality that provides such an instant, in my opinion, response to, wow, that this feels so different now,
And I think because it hits on all components of a memory and just how we experience things as human beings, right? We experience it with like a mind, body, soul connection.
Right.
EMDR processes memories through that mind, body, soul connection, right? We're looking at all the components of the memory. So the images and the pictures that are associated with it, the emotions and feelings, the body sensations, and the cognitive side of things. So looking at what are the negative beliefs or the blocking beliefs associated with it. So we're not just focusing on the emotion, or we're not just focusing on the body sensation. We're looking at the whole picture, and that's why it's so effective.
I agree completely. So if someone wants to, have a session for EMDR, maybe they're not even sure what their memory is, but they're thinking, this sounds really interesting. I've learned a lot today on this podcast. I want to book with you. Of course, we know that they can go to pinkertonpsychotherapy.com. They can, of course, call our main number, 713-800-6999. They can ask for Katie, or if you just ask for EMDR, that's who we're going to direct you to. But tell everybody what your EMDR fees are, your session fee, because I don't remember that off the top of my head.
So $185 a session.
Okay. Okay, great.
For a 50-minute session.
Wonderful. Okay.
And yes, as you mentioned, there might be a client who says, oh, this sounds really interesting, but I don't necessarily know what I would be processing. You don't have to come into an EMDR session with your list of memories. For some people, it is that way. They know, here are specific things that happened to me that I need to process. That's great. That doesn't have to be your experience or your story. You can come into EMDR and go, I just want to experience some healing. I want to experience wholeness. I know that there's some areas of my life that maybe I have some blocking beliefs tied to memories that I don't necessarily remember.
Or understand.
But that's my job as the clinician, to then guide you in identifying what those memories are through a couple of different EMDR skills. But yeah, absolutely. You can come into EMDR without the memories identified. That's what we'll work on together.
And I think that clients take away with EMDR some other skills that maybe oftentimes aren't mentioned, but I know personally for me, and that you walk away with this idea of, I can be my own safe place. I can utilize my cognitive function. I can utilize the feeling in my body. I can learn how to actually do a body scan on my own to go, oh, am I feeling okay? Am I dysregulated? Where is my body right now? I think you learn a lot of takeaways from EMDR that help you in other ways also. And it's so unbelievably empowering as a client, to feel like, wow, I not only did I heal from things, not only do I have this completely new viewpoint of how I look at this and these traumatic experiences or narratives, but I also now feel like I can sit and be present with myself, and I know how to get myself in that place where I feel safe.
Absolutely. It really moves us from the kind of right brain stress response to a sense of regulation, right? And being able to trust our bodies, trust our mind, trust our feelings and our thoughts. It ultimately helps us to evaluate or assess like current stressors, not through the lens of the past traumatic experience, but instead allows us to just assess or evaluate it right as is, instead of always associating it to the past.
I think it's great. I think it's wonderful. I'm such a big fan of it. I also want to mention your socials. I think it's KSMYTH therapy.
Yes.
And that's where people can find you on Instagram and follow you there. And we'll have a clip of the podcast for you to be able to share with your clients. And I really hope that everybody that's listening might take the opportunity to investigate this, might want to try it out and see what their experience, is. And that I'm 100% confident that if they do so, they're going to have some transformation.
Yes.
I think it's really great.
I would agree. And as a clinician and as a past client of EMDR, I've experienced how impactful it was for me, and how it's helped me to really show up as my the best version of myself, to reach my own potential, to experience healing and wholeness. And then I get to see that as the clinician when my clients experience healing and wholeness. And it's very rewarding for me as a therapist to see my clients experience that.
Yeah, that's very well said, Katie. And I think that that hopefully people will have a different viewpoint about it after hearing about it today. So I really appreciate you coming on and sharing this with us and giving us some education on how this works and what it's about. And, good luck to you.
Great. Thanks for having me.
Thanks.